Welcome to this online educational resource for the ASHP ACPE accreditation process for pharmacy technician education and training programs. This module will focus on the appendices associated with the pre-survey packet for your pharmacy technician education program accreditation site survey. It is important to review all available resources before getting started to ensure that you understand the accreditation process. This presentation will include guidance for submitting the appendices portion of the pre-survey packet for an accreditation visit. First, we will review the purpose of the pre-survey packet. Next, I will provide guidance for submitting appendices as part of the pre-survey questionnaire. Finally, I will discuss the next steps following completion of the pre-survey packet. Before getting started, the first thing you should do is explore the ASHP website. The website may look different in the future than the image on this slide, but the same information will always be available. To find the landing page for all technician education program resources, you should go to the Practice Resources tab on the ASHP homepage and click ASHP Accreditation Programs. Then select Pharmacy Technician Training Accreditation from the menu on the right. Here's another way to access the landing page for all technician education program resources. The ASHP website may look different in the future than the image on this slide, but the same information will always be available. Go to the Professional Development tab on the ASHP homepage and click Technician Information. Then select Technician Education and Training Accreditation below the menu on the right. When you first receive contact from your lead surveyor, they will ask you several questions about your program prior to officially scheduling your on-site survey. It is important to be honest and transparent about the current state of your program. This will ensure that you are prepared once the on-site survey day arrives. Think of your lead surveyor as a resource for both you and your program. They should act as the primary source of contact for questions leading up to the site survey. These lead surveyors have a wealth of experience and knowledge related to technician education programs and are available to guide you through the process. They will also be the ones to set the agenda for your on-site survey. Generally, your lead surveyor will send you the pre-survey packet via email to get you started once your survey is scheduled. You can also download the pre-survey questionnaire from the ASHP website. This can currently be found by navigating to the Technician Program Accreditation page and then clicking Preparing for an Accreditation Survey. The pre-survey questionnaire and self-assessment checklist will be the first document linked on this page. You will also receive the pre-survey packet directly from the ASHP Accreditation Services office. Your lead surveyor will send you the pre-survey packet via email to get you started once your survey is scheduled. The pre-survey packet contains 3 portions that must be completed and submitted prior to your on-site survey date. These are the pre-survey questionnaire, the curriculum crosswalk, and the appendices. During this session, we will discuss the appendices. Prior to your on-site survey, you will receive a pre-survey packet to be filled out with information about your program. Your assigned surveyor can act as a key resource for you as you prepare to fill out the pre-survey. Beyond your surveyor, there are many resources available online to help you through this process. Found on the ASHP website on the Accreditation Standards, Regulations, and Other Tools page, there are several items that have been developed by ASHP staff. The model curriculum includes specific ways that each individual standard item can be fulfilled. The curriculum crosswalk is a blank, fillable document in which you can input the details from your pharmacy technician education program curriculum, map the details, including time to teach different key elements in each area of learning, to the accreditation standards, and identify any gaps. There are also several informational videos on certain commonly cited standards, such as developing a strategic plan and successfully managing an advisory committee and documenting its activities. This page contains sample forms that can be used to guide documentation of your program's activities, including a sample strategic plan and sample academic and professional record. Lastly, and perhaps most importantly, on this page you will find the Standards Guidance document. This document includes specific recommendations, details, and best practices for meeting each individual accreditation standard. The guidance document is revised on an ongoing basis and can help prepare you for your survey. In preparation for the survey, it's important to have all necessary documents ready. Here you can see a list of necessary documentation, but this is not intended to be an exhaustive list of everything that the surveyor may ask you for. It will be necessary to have student files available for your surveyor to review. These need to include complete student files for 3 program graduates, as well as 3 ongoing student files for the current class. You will also be asked to submit them with the packet electronically 45 days prior to the survey. Documentation of all supporting coursework and materials must be provided. A comprehensive list of all books, references, and online products used throughout the training program will also be required. Documentation for the simulation component of the curriculum needs to include the simulated component assessment activity checklists. You should plan to provide copies of membership certificates of the program director, as well as program faculty, for appropriate pharmacy associations and/or educational associations at the national and state level. Additionally, you need to ensure that you have complete documentation from all experiential site inspections, along with completed affiliation agreements from all training sites. You will be asked to have a sampling of contracts established with the technician training program included in your packet. Documentation from the advisory committee has its own set of requirements and is covered in further detail within another presentation. It is key that advisory committee meeting minutes from the past 3 years are included in the documentation. Finally, a copy of the certificate provided to graduates of the Pharmacy Technician Education Program will need to be included. This certificate must include all appropriate signatures, including that of the program director and a superior of the program director of the institution. The certificate must also include the name of the organization, program name and location, student name, completion date, and confirmation that the program is ASHP ACPE accredited or in candidate status. Finally, the certificate must note whether the program is entry level or advanced level. A list of all graduates from the program needs to also be maintained. The pre-survey questionnaire will indicate if a standard requires documentation. Let's look at this example for Standard 7. At the bottom of this section of the grid, you will see that the standard requires that documentation be submitted within the appendix. For these items, a copy of the current strategic plan for the program should be included. The questionnaire will also note the number that should be assigned to this document in the appendix. In this case, it should be Appendix 7A. Please do not reorganize, reorder, or rename the items in the appendices. To make sure the appendices line up correctly, please keep them in order in which the pre-survey questionnaire lists. Be sure to label each appendix document correctly to ensure that the surveyors are able to find all the necessary documentation. It is important to follow all guidance provided to ensure that documentation for each individual standard item is complete. The next few slides will provide some tips and best practices for documenting certain aspects of the standards. Standards 1 through 5 cover many of the curriculum-based requirements for technician training programs. For each key element, provide a list of activities that students participate in to achieve each item. Thorough descriptions of all learning activities should be provided, along with a list of resources used to teach each of the required topics. Samples of criteria-based completed assessment tools, such as tests and lab assessment forms, should also be provided. A good rule of thumb when providing documentation for curriculum-based standards is that if the item has already been taught, always send in examples of completed student assessments. If the item has not yet been taught, document how you plan to teach the topic, as well as how you plan to assess students' understanding. Let's take a moment to review some of the appendices found in Standards 1 through 5. Appendix 1C. Provide all lesson plans from each course, including class lectures, exams, schedules, simulation activities, activities performed on externship rotations. For Appendix 1C, be sure to provide lesson plans and syllabi from all program activities, which includes didactic, simulation lab, and experiential rotations. Appendix 3A, provide list of patient-specific medications prepared by students. For Appendix 3A, provide patient-specific examples of prescriptions, pictures of medication prescriptions, how many students have done, patient-specific IVs, types of medications that they have filled, cart fills for patients, etc. Appendix 3B, provide list of non-patient specific medications prepared by students. For Appendix 3B, provide non-specific examples, including automated drug cabinet fill lists, nursing home medication cards, filled syringes of medications for bulk meds for floor stock, for example, acetaminophen syringes, compounded magic mouthwash, crash carts, etc. Standards 6 through 9 each have their own specific documentation requirements, which can be found in greater detail in the standards themselves or within the guidance document. Documentation of Standard 6 regarding the program director requires inclusion of the academic and professional form for the program director, as well as certificates of national and state pharmacy or education association membership. The student-to-faculty ratio for the program should also be included. Standard 7 provides specific information about documentation of the strategic plan, as well as appropriate review, revision, and approval by the advisory committee. Standard 8 includes requirements of the advisory committee for the pharmacy technician education program. Agenda and background materials from previous meetings, as well as approved meeting minutes from the past 3 years, should be included. Finally, Standard 9 sets forth requirements for documenting curricular length and the method used for calculating hours within the program. Standard 10 includes curricular composition and delivery and relates to several different documentation requirements for the different components of the program curriculum. The standard includes information about how each component should be structured and taught to students, as well as documentation requirements for each aspect of the curriculum. It is important to include sufficient detail about curricular composition and curricular delivery in providing evidence for documentation regarding Standard 10. For the simulated component of the program, documentation must include a list of all equipment and supplies utilized to emulate an actual work environment. For the experiential component, a list of rotations offered to students must be provided, along with a list of preceptors with completed academic and professional forms, and a list of qualified pharmacy personnel assigned to training students at each site. Standard 10 also covers curricular composition and delivery for programs using distance learning. Distance learning programs must also provide a description of the technology used in the programs, policies for accommodations for unexpected technology outages, and tools used to verify students for experiential training and test taking. Standard 11 covers all required documentation related to student recruitment, acceptance, enrollment, and representation. Among these items are documentation of all information provided to students prior to enrollment, such as financial obligations. All policies and procedures should be submitted for review during the survey as well, to include policies about screening applicants and ADA policies. Standard 12 requires that complete records of all licenses and national certificates held by faculty and instructors are maintained. Faculty records should include all evaluations completed by students about the instructor from the past 3-year period. All areas specified in Standard 11.6 from 11.6a to 11.6j require documentation to be submitted. This includes qualifications to enroll, the purpose of the training program, requirements for state registration or licensure as a pharmacy technician, requirements for obtaining and maintaining National Pharmacy Technician certification, programmatic and institutional accreditation status, prospects for employment, realistic salary expectations or referral to local, state, or national statistics for salary expectations, total program cost, the program's dismissal policy, including academic and non-academic criteria, including but not limited to the organization's student code of conduct, and graduate performance on national exams posted on public-facing materials and websites. Standard 13 covers many other remaining documentation requirements. Programs must maintain and store these records for a minimum of a 3-year period, if the program has existed for 3 years, or the time periods specified in institutional policy. Many of these documentation requirements have been covered previously, but include items such as program director qualifications, training activities, records from experiential training sites, record keeping of program graduates, and adherence to the requirements of the certificates awarded to graduating students. Section 3 of the standards covers assessment of standard and key elements and includes standards 14 and 15. Standard 14 encompasses assessment of competency expectations and details necessary documentation of all student learning assessment items used in the program. Programs must document and maintain all student evaluations, which should reflect criteria-based feedback on their performance in each component of the program: didactic, simulated, and experiential. Assessment data used in the continuous quality improvement process of student learning assessments should also be kept on file. Additional program assessments include program completion, performance on national certification exams, program satisfaction, and job placement. Standard 15 covers assessments of structure and process. Documentation of this standard should include assessment data in the continuous quality improvement process and, if applicable, documentation of the program's policy and procedures for transfer credit and course waivers. To complete and submit the pre-survey packet, the questionnaire, crosswalk, and relevant appendices should be completed. When labeling the appendices, please be sure to label them as indicated in the questionnaire. Please note the curriculum crosswalk is a required appendix to be included as part of this packet. All items completed as part of the pre-survey packet should be organized in a clear and concise manner and stored on a OneDrive or Dropbox account. The OneDrive or Dropbox account should then be shared with your lead surveyor, the practitioner surveyor, and ASD@ashp.org a minimum of 45 days prior to the accreditation site visit. Your lead surveyor will provide you with the practitioner surveyor information. Notify everyone who needs to be involved and be sure they are clear on their role on the day of the survey. This includes the following: administrator of the organization. The leadership of the institution should be aware of the site visit and willing to meet with the surveyor for a welcome. Current students, graduates of the program, recent graduates of the program so they can speak to how the program prepared them to practice. Advisory committee members. These individuals must be actively involved with the technician program. All items completed as part of the pre-survey packet should be organized in a clear and concise manner and stored on a OneDrive or Dropbox account. The OneDrive or Dropbox account should then be shared with your lead surveyor, the practitioner surveyor, and ASD@ashp.org, a minimum of 45 days prior to the accreditation site visit. Your lead surveyor will provide you with the practitioner surveyor information. In the time leading up to your survey, be sure to notify everyone who needs to be involved and be sure they are clear on their role on the day of the survey. Finally, your lead surveyor is your point of contact and can act as an incredible, valuable resource to answer your questions during this time. If you have any additional questions regarding this presentation, please reach out to us via email at asd@ashp.org. Thank you for joining us for this presentation.